I will thank the organizers for having invited me to this. I am looking forward to 2 days of a lot of learning and a lot of discussion about something that has been dear to my heart for a long time. My name is Rianne Mahon. I've been doing research off and on the politics of childcare at different scales, from the transnational to the local. And usually when I emphasize the politics of childcare, so it's more about sort of the governance of childcare at the municipal level as well as at other levels. But I was tasked with a different task today, and I tried to rise to the occasion and to begin to look at municipally owned childcare, which is something that Martha and I plan to do more work on in the future. So it's a beginning for me. So my argument, we're almost there. We got it? We're getting there. I can tell you my argument. So the argument is that I agree with Martha that municipal provision of, surprisingly, municipal provision of childcare can play a really important role in the expansion of universal, affordable, quality childcare across Canada. However, it's not likely to become the dominant form, and you'll see why with my next slide. However, there's another however, municipal centres can play an important navigational or lighthouse role for the system as a whole, and for allowing provinces and the federal government to learn. And I take the term lighthouse from the early days in Alberta, when in fact Alberta led the rest of Canada in terms of quality childcare. And they established in cities like Edmonton, Calgary, Red Deer, and Medicine Hat these lighthouse childcares. Not all of them are municipally run, but most of them were, or a good number of them were. And the idea was they would provide a navigational beam for the rest of the sector. So that's kind of the theme I'm going to take. I'll then use there was a wonderful study, a report done on the Toronto system of early learning and childcare. So I'm going to draw on that to sort of try and begin to make my argument about the navigational role. And then, of course, you can say, well, Toronto's not the rest of Canada. So I've got a few examples from smaller places that show you that there are also beacons of light there that we can kind of follow. And that finally, I will argue that the provinces can facilitate this. Some, like British Columbia, are beginning to do so, and they're helping municipalities to develop the brains to think about this, as well as to do this. Other provinces, like the one I live in, which is Ontario, in fact, are going backward. So there's a good and there's a bad story here, and that's basically where I'm going to go. So, next slide. That's the argument. So, what's the extent of municipal provision in Canada today? There is none in Newfoundland. There is none in Nova Scotia. There is none in Quebec, and there's none currently in Manitoba. In fact, as I understand from a study that Martha did, Newfoundland currently actively prohibits municipal involvement in the provision of childcare, although this is potentially open to change. So that's a little glimmer of light. Prince Edward Island has 2, New Brunswick has 3, Saskatchewan has 3, Alberta has 4, British Columbia has 63, and Ontario has 109. But even in the latter, these account, even in British Columbia and in Ontario, quite clearly, they account for a sort of small percentage of the total. And municipally run childcare has been decreasing. The Alberta once had municipal lighthouses, as I said, in Calgary, Edmonton, Medicine Hat, and Red Deer. All were gone by the mid-1990s when the Canada Assistance Plan folded. In Ontario, in 1998, municipal centres accounted for 18% of childcare centres. Now they're down to 2%, following closures in cities like Windsor, Peel, and Waterloo. And I was in Waterloo when this happened and could do nothing to prevent it. So how about some good news, the Toronto story? Although public municipally run childcare only accounts for 3% of childcare in Toronto, it accounts for 10% of infant spaces, and we know how difficult it is to get an adequate number of infant spaces. It's also concentrated in low-income and vulnerable communities, and I didn't realize until I read this that in fact it's municipally run centers and commercial centers that are the main centers in low-income communities in Toronto. which tells you something about the popcorn system. It pops up in communities that can afford it. The Toronto system has provided an important emergency capacity. When COVID hit and childcare centres were closed, the city could turn to its childcare centres, and within a very short time, 8 childcare centres were providing essential childcare for firefighters and hospital workers and the like. In addition, when commercial units have fallen, the city's been able to step in and take over. So again, it helps to provide stability in a system which certainly needs it. More importantly, in the longer run, it provides high-quality jobs with fair wages and good benefits, which provide a benchmark for the rest of the sector. And recently, I was driving to a demonstration with a friend who has been long involved in childcare activism in Ottawa, and my husband was in the car as well. And he reminded me that when our child, which was a number of years ago, was in daycare and childcare, he was on the board for our nonprofit system, and they looked to the city for the benchmark. Again, when you were in bargaining, when you had to negotiate, they looked to the city. This is a standard to try and follow. They also have highly qualified staff with more professional development hours than the rest of the sector, including training in mental health, to LGBTQ+ and anti-racism. And in Toronto, this is really important. They have a very important anti-Black racism program, and the people in these Toronto childcare centres have been really sort of trained in that, and this has been quite crucial because it's an important part of the population they serve. They're important in terms of piloting new initiatives before they're scaled up from implementation across the sector. And again, my colleague in Ottawa Amanda told me that they were quite important in helping to develop the quality assessment system, which focuses on a much broader range of things than the provincial system, which was a much more technical kind of system. And finally, they provide support through administrative, human resources, operations, quality concerns, and training to the wider community of childcare-based sector. So that's Toronto. Okay, that's Toronto. Oh, I was going to give you one nice little example that the study that I'm drawing on sort of went to a number of centers, and a number stood out, but this one I thought was kind of interesting in Kipling. The center shares location with the Kipling Acres Long-Term Care Center to facilitate intergenerational programming, which results in collaborative activities such as children delivering the mail to residents and residents coming to visit the center. The center is also recognized an outstanding design model for early learning and childcare, with low window benches, welcoming entrance areas with the book lending library, and the outdoor space has been redesigned to provide an intergenerational garden area, which I think is pretty fantastic, being a gardener myself. This center is often visited by others interested in physical space and unique programming. Okay, we're still going to leave Toronto now. So not only in Toronto, what about Rainy River, Ontario, which is in the north? It covers a very large area, 15,000 square kilometers, with a population of only 20,000 people. It was faced with the challenge of the introduction of full-day kindergarten came, for those of you who don't know it, in Ontario for 4-year-olds, and that sort of threw a lot of childcare centres in the tailspin, and that actually contributed to the closure of some of those municipal centres I referred to earlier. What Rainy River decided, instead of closing, is to actually create a public sort of system which include all of the childcare centres covering that area, which are 9. This allows for facilities costs and other administrative savings, which has then allowed them to boost the salaries to pretty well a level of compensation of early childhood educators working in full-day kindergarten. Employees, of course, because they're employees of the equivalent of a municipality, they're part of pension and benefit plans, which otherwise they are not in Ontario. Early childhood educator for school age, if you're providing for school age, it's before school and after school, so what do you do in between? This system allows people to sort of actually have a full day's work rather than 2 part-day shifts. And finally, in that area, there are a lot of people who work the 4 days on, 12-hour days, 4 days off. And so it's actually then working to provide sort of the kind of childcare needed for people with that kind of work shift. How about Russell Township in Ontario, which is located pretty close to Ottawa, but covers it with an area with a population density of 98.6 square kilometers. Here, the municipality took over one closed and one struggling for-profit center and expanded them to add 456 new spaces, which is nice. This improved, as we moved to municipal owning, it improved compensation, including eligibility for pensions and benefits. And moreover, I think it was Morna earlier on raised the question of the qualifications, trying to get the qualifications up. They're working with graduate educators with the cost of schooling toward their registered ECE designation, working with a local college to provide sort of a program which allows them to kind of work and learn as they're working. All right, Ontario. Let's move out of Ontario. How about Drayton Valley, Alberta? Population 7,000.
She runs it. She's right next to you.
Fabulous. Maybe you should tell more about it. But okay, I'm going to help your own. In Drayton Valley, Alberta, they developed a plan to establish a publicly delivered childcare facility to attract the families of oil sands workers. Staff are paid union rates and are employees of the town. They meet most Alberta maximum qualification requirements, it shares operating policies, procedures, and related documentation with other centers. So again, it works as a kind of lighthouse for other centers in that area. When a new center is being developed in the region, the center manager is often asked to provide support and mentorship. So congratulations, good work. Now we'll shift scales. What role can provinces play? So there's a good and a bad story. I'll begin with the good. British Columbia introduced 2 new provincial funds in cooperation with the Union of British BC Municipalities. The first one is Childcare Community Planning Program, which administers grants enabling communities to develop childcare space creation plans. This is really important because when I did a study in 2006 of childcare policies in 13 cities across the country, including one in the Yukon. And what was really striking to me was so rarely did cities have the brains for thinking about childcare. So what this does, I think, is begin to get cities to develop the brains to think about childcare and to do that kind of planning. Secondly, BC introduced a community childcare space creation program, which provides local governments up to $1 million to create new licensed childcare spaces for children 0 to 5. Under this, priority is for programs directly operated by local governments or under other public sector organizations for underserved populations and for non-standard hours. Now for the bad, and I know that Gordon and Sue Colley know very much very much about this. Ontario, at least, sort of did give municipalities a role in planning and did give them the responsibility for thinking about it. That's good. Unfortunately, it's moving backwards. Currently, the government has passed regulations eliminating municipal discretion about which centers should be preferred to provide subsidized services. Previously, 16, as Gordon and Sue their research showed, had decided, and this included my own city, Ottawa, to only sign with nonprofit providers. This also included Toronto. The province is trying to take away that ability. Secondly, all municipal childcare programs are now required to undergo audits to determine whether the services could be offered by a third-party provider instead. Finally, service system managers are required to ensure opportunities for community-based delivery participation are exhausted before direct childcare delivery by consolidated municipal service managers. In other words, if you can't do anything else, can you sort of opt for public provision, which is really retrograde. So I'm coming to my conclusions, which are going to go back to the beginning. Although they're not signatories to the federal, provincial, Canada-wide early learning and childcare agreements, municipalities can play an important role in expanding universal, affordable, quality childcare across Canada, and they should. They can create high-quality, innovative centers offering equitable wages, good working conditions, and thus function as lighthouses for the rest of the system. Provincial governments can impede this, or they can follow British Columbia's good example and support not only municipal planning, but also childcare provision. And I finally ended up saying, I'm also hoping, and I'm working at the municipal scale to sort of fight back against my current provincial government stance on this. Thank you.